hearing empowers us, and it helps us in our everyday lives. It helps us to work, to socialize, and to communicate. Healthy hearing is important, although if you're not being able to hear, it might not hurt you physically or it's not life-threatening. However, it will have a deeper impact on your social and your emotional health. Kuzuzampala, and welcome to Dungtsho BBS. I'm Sonam Chiki, and I'm your host for today. For this episode, we have a very special speaker with us. He is a speech pathologist and an audiologist. Welcome to the show, La.
Thank you, Sonam. I am Pelden Ongchuk. I work as an audiologist and speech pathologist at our National Referral Hospital. I had been working there for last 7 years, and I hope you enjoy this show, and then you get lots of information from me, and then I hope this show can advocate and educate most of the parents and caregivers.
So birth defect in sensory system is also one of the major reasons for hearing loss, and also high-risk infants are susceptible to hearing loss. So can you enlighten us on it? And before that, can you please explain us what does high-risk infant mean?
High-risk infants, the neonatologists at our NICU and KMC, the premature babies, the babies, mostly with premature babies, very low birth weight babies, and then some babies get attacked with meningitis, all this neonatal jaundice, all twin babies, all these things are susceptible for the hearing impairment, not just hearing, any other sensory deficits also. So these are the high-risk babies. These are the few high-risk babies. We have more, but the few high-risk candidates.
Okay. What are early identification and intervention for the high-risk registered baby?
Early identification, it's very important for the early intervention, especially with the hearing. Because if there is no hearing, definitely the communication skills, the speech and language is going to be hampered, and then it's going to be delayed. So as a clinician, we stress more on early identification of hearing abilities in our National Referral Hospital. Our doctors and the nurses from the neonatal NICU, they refer to us the babies with high risk registered, and we do the hearing screening. And if we find a problem with the child, we ask the parents to refer the child back after 2 weeks. And then after 2 weeks, we do the same test. And then if the child is still having a problem, we ask the parents to get the child back when the child is getting a neck control or head balance, so that we can do other related tests to using the sound and by seeing their localization of heads. So if they are having problem at that time, then we start to intervene with using the amplifications like hearing aids, then counseling the parents, give the proper home remedial parts and home therapy procedures to the parents, and then that's how we intervene. After 3 months, we again ask the parents to review back the babies to our hospital, so that we track down what the baby has acquired in part of language, in part of gestural mode of communication. So basically, while we screen for the child's communication abilities, it's not necessary that the child should start speaking. We have to identify the child right before the child attains the first word, by studying the way the child is responding to our verbal mode of communication, by charting the gestural mode of communication that the child uses. Everything has information on us, because see, for example, if the child uses the gestural mode of communication to get what he wants at the age of 7 months, so that is totally fine. But if the child is using the same gestural mode of communication during the age of 2.5 years, that's completely delayed expressive language. So the early identification will definitely shorten the period of that delay in speech expressive skills, because right from the beginning we try to intervene. We try to educate the parents, we try to educate the caregivers or teachers or any other ends to bring the child to the right track while the child is growing up. So in a way, there is no reason for the parents to wait for the child to speak to start the intervention. In Bhutan, we have lots of kids, not just kids, adults also, other population. As I go around the country and see most of the cases, we see some with the congenital defects, like we call it anosia, atrasia, the absence of ear canal, ear pinna, all the structural defects and all these things. So most of the congenital defects like absence of ear canal and pinna don't have a hearing loss inside the nerve. They have the hearing intact from the nerve. At inner part of the ear, it is fine, completely fine. But what happens is the conduction of the sound from the outer ear, it's getting blocked. And they seem to get a hearing loss. They don't seem to respond to our conversation, request and all those things. So basically in Paro, in our Wangsil Institute, we have 5 to 6 candidates there. In Merak and Sakling, there are a few candidates. In remote areas, mostly it's prevalent in remote areas. We don't know why, but maybe some factors are predisposing for those kind of congenital defects. But yes, we have, and it is responsible for the hearing loss. And if we correct the outer part of ear and then give the sound waves a chance to enter the inner ear without any obstructions, most of the hearing losses can be managed without any assistive devices. But for some, there are mixed hearing loss where the nerve is also getting involved with these congenital defects, and then what we do is we give a hearing aid that is directly placed on the bone part, the mastoid part, and then the sound gets amplified and directly fed into the inner ear part, so that the child gets into the communication activities with the social outer part.
So the way to correct is through a surgery?
Yes.
Because we are always on a go and we need to work to survive, we often forget about the dangers lurking in our workplace, which is like the second home for us. So what is noise-induced hearing loss?
Thank you very much. It's a very important question, and then we need to really work on this, how to advocate and then really communicate to those who are susceptible for this kind of hearing loss. A noise-induced hearing loss, by name itself, we get to understand a thing of it. So it is a hearing loss caused due to a continuous exposure to noise over a period of long time. So maybe the noise can be around 90 decibels or more. And we have in our occupational hazards limitations, we have the hour limitations for that intensity of noise. So we have all those things. And basically noise-induced hearing loss happens to those population like who gets exposed to noise in everyday life, working conditions like in factories, usually like the iron factory, metal factory, and armed forces, because of gun shooting gun and practice for all these things. And Others are drivers and crashers, stone crashers, all those the laborers. And power plant, those who work in power plant. A modern power plant, they are not that much noisy, but before ones like Chuga hydropower plant, all those things, they are getting exposed to continuous noise. Continuous noise is another factor which can lead to noise-induced hearing loss. And clinically, we observe noise-induced hearing loss with the tinnitus, like a ringing in the ear or buzzing sound in the ear, or uncomfort, increase of loudness, and then giddiness. All these symptoms are observed with the noise-induced hearing loss. Once it's a loss, it cannot be restored back. Clinically, we get to observe a deep notch in the 4 kilohertz when we do a hearing test, and then we diagnose them as a noise-induced hearing loss. That usually happens with person who are working in factories, and not just with occupation. We need to either go on emphasizing on the leisure kind of thing. Those who work in discotheques, party halls, and triangles, all those the musics and the loud musics, getting almost 7 to 8 hours exposed in a day. So that is enough to make a person acquire a noise-induced hearing loss. And even our religious functions also. People like those who perform religious functions, they also are susceptible for noise-induced hearing loss. And we do have quite a good number of cases to show as a proof also.
Due to this ceremonial
ceremonial instruments.
Okay. It's a cliche when we say that prevention is better than cure, but prevention is always better. So, is there any prevention to such hearing loss?
We need to modify the surroundings. We need to do a real study on how much the noise is accumulated, how much is the noise, and then how many hours the individual is getting exposed to that level of noise in a day. So we need to study all those things, and then we clinically before the client is having a condition like this, we can prevent from such a condition by studying the environment as well as the number of hours exposed. So, for example, if the client is working at a factory, a stone crushing factory, and then we go there, we measure the noise level, and then if the noise level is above 120 decibels, then we limit a proper work regime should be there, work rest regime should be there. We should limit the client not more than 30 minutes in a day. So if the stone crushing is giving 90 decibels of noise, so he can work around 6 to 8 hours in a day. So that's how we design the timing of the labor out there. And then in a way we can prevent like that proper work and rest regime by constructing all those things. And the other thing is architectural designs, like noise can be reduced from the source. So if the source of the noise is this machine, and then if this machine's noise can be, well managed in this source by giving some walls, then architectural designs are also important for reducing the source. And other parts are like using the ear protective devices, like ear cups, ear muffs, and inserts. So for this, we need to study about the noise, the type of noise. If the noise is basically low frequency noise over a longer period of time, then I think ear muffs should be used. So if the noise is high frequency and it's for the longer period of time, I think ear cups should be used. And if the noise is a mixture, like in recreational areas, loud musics and all, the mixture of noise, high frequency, both high frequencies and low frequencies. I think ear inserts and ear muff together should do. So these are hearing protective devices. That's what we call. I think our government should standardize such regulations for the laborers, so that the hearing is well preserved, conserved.
Do we get those hearing aids in the hospital?
Yes.
Not this protective devices, but then the one which helps us to hear.
We have a few numbers of hearing aids and few types of hearing aids, and for now we see the importance of the client. As far as hearing is concerned, I think for the learning group of people like students, Gelong, Nun, those who use their hearing for learning purposes, I think they are more important. Hearing is more important for them. So if the hearing loss is present for them, then we provide the hearing aid to them. But for general public, it's expensive, high-ended medical equipment, so it's not possible to give it to them. So we issue to the students and Gelongs and nuns.
So you prioritize?
We do that.
Okay. My grandma used to say that she often hears a humming noise in her ear, and it keeps coming and going. It was not life-threatening, but it seemed to be a constant botheration. So for the medical term for this condition is called tinnitus. So is it a disease or is it a symptom, tinnitus?
Yeah, I say that tinnitus is a symptom of some other disease factors. For example, if your grandma was suffering from hypertension for last few years, and then under medication, hypertension itself causes tinnitus, and medication also causes tinnitus. So it's a drawback of hypertension and medication. And presbycusis is what we call as a hearing loss due to aging. So that is also accompanied with the tinnitus. So tinnitus is getting accompanied with another factor. So I better call that as a symptom, not a disease. Okay. So noise-induced hearing loss is concerned, tinnitus is there. When noise-induced hearing loss is there, tinnitus is there. If you are having diabetics, and if you are under the medication of diabetics for last 10 to 15 years, then people tend to get tinnitus. If you are getting strong medication or all those things, the tinnitus is there. So tinnitus always comes with other factors, not just alone. So again, it's better to call that as a symptom.
So it's more like a side effect?
It can be side effect at some point of time, but it is mostly accompanying symptoms with other factors, health conditions.
So by treating the other ailments, then this will be treated. Okay. With age comes certain difficulties, physically or mentally, and our physical organs degrade gradually. As it is inevitable for hearing to be not as sharp, can age-related hearing loss be prevented?
It's very natural for the human being or any other animals. When we get older, our sensory system, it gets degenerated. Not just hearing, everything. So, but yes, it can be regulated and then prevented. Not fully prevented, but the lifespan of that hearing sensitivity can be prolonged. So maybe we can protect ourselves from getting exposed to loud noises every day. Can be top listed prevention, and then the other use of alcohol, smoking, then prolonged medication, all those things can also affect. So if we refrain from all those things, we are just regulating our span of hearing.
Okay. This is just an additional question I just remembered. Does ear infection lead to hearing loss?
Yes. Ear infection, while we diagnose a hearing loss, while we do a hearing test and diagnose a hearing loss, a type of hearing loss is, we call it a conductive hearing loss, a sensory neural hearing loss, or mixed hearing loss. So sensory neural hearing loss is a hearing loss that is caused due to the nerve impairment. And conductive hearing loss, just like what you said, what your questions focuses on, it's like the sound waves are getting disturbed in their conduction area, where the ear infection may be disturbing the sound waves to pass into the inner ear. So definitely, yes, the ear infections are having a huge impact on hearing sensitivity.
Is there any assistive devices other than the hearing aid available in our country?
Usually, at present in our country, we just deal with the analog kind of hearing aid, where we cannot program the hearing aid according to the loss that the client is having. For example, noise-induced hearing loss, they have the 4 kilohertz notch, and press spike is because of old age, they will have high frequency sloping hearing loss. So what analog hearing does is they just amplify all the frequency hearing loss, and then at some point of time, at some frequencies, it makes a discomfort to the patient. So in that case, we need a digital programmable hearing aid. And there are some people who goes to other neighboring countries like India, Bangkok, and Singapore, and then they get their hearing traced from that country, and then get the programmable hearing aid. But people who cannot afford to get all those digital kind of hearing aids, they just manage with analog, and then the side effects are there compromised. They compromise all those side effects. And other than digital programmable hearing aids, we have advanced till cochlear implant. They implant the electrodes to the inner part of our ear, cochlea, and then that the noise to signal to noise ratio, the clarity is almost equal to normal ear, the cochlear implant. It's much expensive and for the client, but the clarity is much better. So the assistive devices in hearing in advanced countries are there. So it's not present at our country. We are just dealing with the analog kind of hearing aid, but all the types of hearing losses, they are not getting the proper benefits from the analog hearing aids.
Okay. Thank you so much for your time, your effort, and your sincerity. We really appreciate it. We do. To be able to feel what you hear and to be able to hear what you feel is a beautiful feeling. So I'm pretty sure that with today's episode, you got to learn more. To know more on audiology, you can always visit the Audiology Center in the hospital. Thank you so much, love.